All right, as a runner, this week's medical moment really hits home because we are taking a look at foot and ankle pain.
Sometimes injuries are caused by overuse. Others, as Dr. Brian Buchanan tells us, are a result of doing things the wrong way or maybe being overweight. Take a look. Being a foot and ankle specialist, Dr. Brian Buchanan has no shortage of afflictions that he deals with on a daily basis.
You know, heel pain is a big one, particularly in athletes. Ankle pain, those with chronic deformities, the forefoot, hammer toes, bunions, those type of scenarios are typically what we see.
And when those problems go untreated, they move on up the body. That's something we all learned when we were kids.
The foot bone's connected to the leg bone's connected to the knee bone.
It all starts mechanically with the first strike and with the first step, and that starts in the foot. So someone with bad mechanics not only can affect their foot, their ankle, but also even their lower back. We see a lot of kids that have kind of chronic lower back pain, and it ends up coming from a flat foot that we can very easily treat. Even though their back is normal, they have no problems there. It all stems from how they're walking. So it certainly does relate to the foot type and foot position and the mechanics of how you walk, run, or do activity.
Speaking of mechanics, the way that most people run can cause severe problems.
And one of the biggest things we see with runners or any type of high-impact athlete is heel pain. It's a direct weight-bearing force with heel strikers where they hit that first, it gets injured, and they develop kind of classic symptoms of heel pain, and those are certainly treatable. The earlier we treat any of these problems, the better. So mostly in the athletic population, it has to do with overuse, tendinitis, stress fractures, things like that.
Then there's the Achilles heel. That's the thing that Dr. Buchanan calls the root of all evil. A rupture can be absolutely nasty, and the #1 cause of it in his book, aging ballers who just can't give up the hard court.
Basketball is one of those things I almost start telling people, unless you absolutely love it, when you get over 40, the increased risk of Achilles ruptures is significant, and that's almost what we see. A lot of Achilles ruptures are from basketball players. So.
Another growing cause of foot and ankle trouble is the growing waistline of Americans.
And now with our society unfortunately becoming bigger and bigger, and the obese rate is going through the roof, so to speak, these things that we term injuries in the athletic population, I'm starting to term as an injury in the non-athletic population. It's just over a shorter or much longer duration. So adding extra pounds with every step ends up developing some type of injury scenario to the foot and ankle. So it's tricky. I mean, people that carry extra weight or have an increased risk of having some of these issues we talk about.
So what can we do? #1, stretch. #2, know your limits. If you feel a pain, give it a rest. And finally, don't hesitate to seek help.
Really to try to prevent injury. And all of our goals, it's nice to treat these problems, of course, but I'd much rather prevent them from even happening if we can do it. And that's not something you always need to see me for, but just educating yourself as far as what kind of foot you have and what you need to get this better, and really just prevent it from happening in the first place.
Well, that's great information. That's really good. All right, and of course, you can watch all of our medical moments online.
Just click on the News tab at the top of Fox17online.com homepage.